Okay, my name is Idami, so I'm going to be doing active range of motion measurements on you for ankle dorsiflexion. So I'm gonna have you lie down on the bed with your feet hanging off the bed. We have the um the pillow under his legs just because my bed gives a lot, so it was having his knees bend. So the fulcrum will be aligned with the lateral malleolus. The proximal arm midline will be aligned in the midline of his of the lateral aspect of his fibula, and the proximal arm will be parallel to the lateral aspect of his fifth metatarsal. Sorry. So go ahead and bring your toes as far towards you as you can. And he measures at 8 degrees of active range of motion for ankle dorsiflexion. For the other side, same thing. The fulcrum is aligned with the lateral malleolus. The proximal arm is at the midline of the lateral aspect of his fibula. And the distal arm is parallel to the lateral aspect of his metatarsal. So go ahead and bring your toes as far towards you as you can. And he is at, let me see, 11 degrees of active range of motion for ankle dorsiflexion. My name is Idamli, so I'm going to be doing a grade 5 manual muscle test for ankle eversion. The primary muscles used for during eversion are the peroneus longus and brevis with plantar flexion, and eversion with dorsiflexion would be the extensor digitorum longus and the peroneus tertius. Anyway, I'm gonna have the client sitting down with their feet hanging off of the table, so you could go back a little bit. My proximal hand is going to be stabilizing just above the malleoli, with my distal hand providing resistance on the lateral aspect of his foot. So and he's also in neutral position, so relax. I'm gonna have you push against my hand as I apply resistance. Do it one more time. Okay. And now the other side. Okay. Same thing. I'm going to stabilize just above the malleoli, applying resistance to the lateral aspect of his foot, and I'm gonna have you push against my hand. Okay, one more time. Okay. And so since he was successfully able to go through full range of motion with maximal resistance to the lateral aspect of his foot while completing an eversion motion, he successfully completed a grade 5 manual muscle test for ankle eversion. My name is Idami, so I'm going to be performing the anterior drawer test on you today. This is testing for lateral ankle ligament instability. The sensitivity for this test is 53 and the specificity is 100. So this test is ideal for ruling in for lateral ankle lateral ligament instability. So for client position, I'll have you in supine position with your feet hanging off of the table. And for the test, I will be stabilizing on the anterior aspect of the tibia and providing an anterior glide to the calcaneus and talus. So for his left ankle, there was no laxity whatsoever, so that would be a negative sign for or a negative test for this special test. And same thing for the right ankle. I'll be stabilizing on the anterior aspect of the tibia and providing a anterior glide to the calcaneus and talus. And compared to the left side, there is some laxity in the right ankle, and I can feel some translation of the calcaneus and talus. But it would still be a negative sign for the anterior drawer test just because the translation isn't excessive. If it were positive signs, then we would have excessive translation of the anterior glide of the talus and calcaneus. My name is Idalmi, so I'm going to be doing the dorsiflexion external rotation test on you. This is testing for any injury to the syndesmosis. The sensitivity of this test is 71 and the specificity is 63. So the clinical value for this test is weak for rolling in and out. I'm going to have the client in a seated position with their legs hanging off the table in 90 degrees of knee flexion. For this test, I'm going to stabilize at the ankle, grab onto the calcaneus, and using my forearm, I'm going to have their ankle in dorsiflexion and then externally rotate. Do you have any pain with that? Okay, so that would be a negative test for his left side. And for the right side, same thing. I'm going to stabilize at the ankle and grab the calcaneus with my other hand using my forearm to dorsiflex and then externally rotate the foot. Do you have any pain with that?
No.
So since he doesn't have any reproduction of pain, that would be a negative test for the dorsiflexion external rotation test. My name is Idalmi, so I'm going to be palpating for your fifth metatarsal. So it's going to be on the lateral aspect of his foot, just right here. And if I continue palpating proximally to that, I'll find a bony prominence where his styloid process or the base of his fifth metatarsal is. So just distal to that is his fifth metatarsal. And then on his other foot, there you go. Same thing, lateral aspect. If I palpate proximally, I feel the bony prominence right here, the base of his fifth metatarsal, and his fifth metatarsal is just distal to that.